Hello, everyone. Welcome to Breathing Exercises with Juvanni. Today we have Dr. Sophia Din. Can you please introduce yourself, Dr. Din?
Hi, Cesar. Thank you for having me. My name is Dr. Sophia Din. I am a board certified family medical doctor. I am also a geriatrician where I have served as a medical director of a nursing home for 6 years. I also do a lot of anti-aging treatments and basically help people anti-age with vigor and with a lot of rejuvenation. So thank you for having me. The reason that we want to learn breathing exercises is because we are in the midst of a pandemic. Which is attacking our lungs. And very soon we will also be in the midst of flu season. So it will be even more important for everybody to keep their lungs healthy and strong. And sometimes breathing exercises, when done appropriately and properly, they really contribute to lung health and in the maintenance of lung health. So definitely, if you have any of the symptoms or any of the signs that we are going to be talking about today, then it is worth it for you to watch our video.
Well, we're going to start by asking you a few questions about these breathing exercises. And the first question I have for you is that why is it important to know these techniques, Dr. Din?
So, as everybody knows, that breathing is something that we unconsciously do all the time since we are born. But if a fun fact that I would tell you is that a normal average human being breathes at least 24 to 26,000 times in a day. And this is something that we unconsciously do so many times in a day that it makes sense for us to maybe do it consciously a little bit, and also to see if doing it consciously and correctly will it change the way our bodies feel. Breathing is the mechanism, is the method with which you will get oxygen to your body, and your body is going to exhale carbon dioxide outside in the atmosphere. Why should you listen to me telling you about breathing exercises? Well, I am a doctor. I'm board certified in family medicine. I also am a geriatrician and an anti-aging. I specialize in anti-aging. I work in New York, and this is something that we have been training our clients and our patients for years. It
Thank you very much. Yeah.
Yes, I would like to just add here, the clients that we have taught breathing exercises have really improved their lives. And there are a lot of people who are doing immense amount of work in this field, and especially now with this pandemic going on, which is affecting our respiratory system. It becomes even more important for us to really know how to breathe well, to breathe better, and to really promote our immune system and make our lungs stronger.
Thank you very much, Dr. Din. And now that you mentioned this techniques and this type of breathing that we need to do, could you give me a top reasons to know how to breathe correctly?
So basically, top reasons, like what are the things that you might consider, like if you like, why should you even be listening to somebody who's trying to teach you breathing exercises? So basically we have a series of screening questions for people. So we ask them that, do you have nasal congestion? Do you suffer from chronic fatigue? Do you snore at night? Do you wake up frequently during while you're sleeping? Do you wake up tired even though you have slept through the night? Do you suffer from teeth grinding? Do you suffer from weight gain, or do you fail to reduce your weight even though you are on a great diet and you're exercising, and your weight just doesn't come to seem to fall off of you? Then some of these things need to be evaluated to figure out if it is something that your system, you're not breathing well, and that may lead to you not oxygenating that well, and that may lead to some of the problems that our body can eventually have. So when if your answer is yes to any of these questions, it makes sense for you to figure out if you're breathing correctly. I mean, this is something that you're doing like all day long. So
Yeah.
should you be breathing from your mouth? Should you be breathing from your nose? It becomes important for us to know this.
Definitely, Dr. Din. And the next question I have here is, what is the best way to breathe, Dr. Din?
So, through ancient times, the ancient yogis used to teach their cultures and their people to breathe slow and to breathe through their nose and to breathe deep with engaging their diaphragm. And diaphragm is like basically a muscle that separates your chest from your belly. And basically when you take a deep breath in, your diaphragm relaxes and allows your lung to expand. So you take the oxygen, take the air in, to use it, to take the oxygen out of the air, and then basically the diaphragm pushes up and exhales, helps the lungs exhale the carbon dioxide out. So basically this is something that, it's like the best way to engage your diaphragm is to breathe through your nose. And even the ancient cultures and in several different cultures have taught the people this kind of breathing. But now, very quickly, science is also catching up to this ancient wisdom, and it has been tested. There are so many books that are now being written and have been around. There is even Dr. Gilimino, which I have put his picture also up on one of our slides, where he's the father of sleep medicine at Stanford, and he just passed away last year. But he did so much work on sleep apnea and was a continuous proponent, and he would tell everybody to breathe through their nose. And now serious work has been getting done on this nasal breathing, but this study in science and medicine is very recent, so it hasn't really permeated to everybody, but it is coming very quickly. And again, in this during this pandemic, this will become possibly a way for us to really engage our clients and our patients and teach them how to breathe in a way which relaxes their systems and does not put them in a fight or flight mode. Because our immune system works the best when we are relaxed.
Thank you very much, Dr. Din. And well, the next question I have for you is, what are the most important breathing techniques that you will be teaching us today?
So today I will be teaching only box breathing, but basically during this seminar and this webinar, we will be going over not only breathing techniques for anxiety management and panic attacks. We will teach about breathing techniques so that you can naturally put yourself to sleep. So many people, due to anxiety or other issues, will not be able to fall asleep. And sometimes just by learning how to breathe, you will be able to put yourself to sleep. Then we will talk about breathing through pain. And sometimes that is difficult, especially this kind of breathing is routinely taught to mothers when they're about to give birth, and it's called Lamaze. But basically, that breathing technique can be useful for anybody else going through any other kind of pain, and that is also, we are going to go over it. Um, there is one kind of breathing that we also tell people to, when you are suffering from chronic fatigue and stuff, how to increase your energy. And that is like an energy boost in the morning. A lot of people like that breathing technique also. So basically, we're going to talk about some of these breathing things which we really recommend to everybody routinely, and also how to know it for your own self. One other thing that we're also going to go over during this series is to talk about how you can tell how your lung is functioning without going through any particular testing. This is something that we it has been this process has been talked about by several breathing experts, and I'm also going to show you how to do that. So this is like kind of a breath hold mechanism until you feel the air hunger, and that is something that I will also teach, and we will also go on to talk about what is a normal breath hold, what is a breath hold where you should actually definitely do some exercises so that you can increase the resilience of your lungs.